My name is Aaron Graben. I'm the owner and president of Titan Realty Corporation. And what we're doing today is going to be talking about giving you insight for healthcare professionals into the commercial real estate ecosystem as it relates to the COVID-19 financial paradigm and how to position healthcare professionals' real estate lease expense through this challenging time. So we recognize that an office or retail lease conversation is trivial to the work that is being asked of our healthcare professionals to save our lives during this pandemic. And we debated this doing this webinar, but we've received so many calls from our healthcare clients and client doctors that we felt that, relating to their lease expenses and closures and the effects of their income and their businesses, we hope our perspective and advice can be used to help provide direction and benefit those who are on the front lines and that we're depending on them more than ever. We at Titan York want to thank all frontline healthcare workers who put their lives on the line every day, and I wish I could stress it more. And I know there's so many different kind of healthcare providers, so I want to be in this presentation we're going to be generalizing healthcare professionals. So we know that there's different models between specialists and generalists and dentists and veterinarians. So if we say something that you feel does or does not apply to you, know that we can address that later on and offline. So Titan York, we are a tenant representative only brokerage corporation. We only represent the tenant in the renewal and relocation of your lease. My name is Aaron Graben. I'm the founder. I have over 20 years of experience. And the next presenter is going to be Madden, and he's the commercial healthcare lease analyst, and he's amazing. So I'm going to talk about COVID-19 and its impacts on leasing, and Brendan is going to be talking about your lease in general and what you need to know. So let's just go over the agenda. So the COVID-19 financial paradigm and its effects on commercial real estate, I'll be talking about that, the timing, social financial deferral, so deferral rents, healthcare tenant leasing advantage. So really the position that you have in the market as a healthcare provider and how important you are to landlords financially in general. So Brendan Madden is going to talk about your healthcare real estate lease, why it's important to you, how it's important to the value of your practice, and what the lease agreement can do for you, and tips and strategies for negotiations. So let's talk about the financial paradigm again. We can't point to any historical relevant model when we consciously and collectively stopped our global economy and restarted again. We do know that what the financial model is not. So it's not generated from a lack of consumer demand. We know that it's not a credit crunch caused by fraudulent betting on mortgages in 2008. It's not 9/11, where people still went back to work in a short period of time. And we know that it's not local. So you can't outrun your faltering economy to a better one. So like the virus, it's everywhere. Like if you wanted to move your money or your business to a different town or city or province, you can't do that. You're frozen in your geographic location at this time. And but there is a paradigm that's coming out of it, and it'll seem very familiar, this financial paradigm of what the COVID-19 has done for healthcare and other industries, what it's doing for leasing. So we'll talk about the commercial real estate ecosystem, be you landlord, lender, tenant, in general, the consumers disappeared. They've just disappeared. They are no longer there. Your patients are not showing up for the most part. Of course, in hospitals, that's a different story. But the ecosystem has unprecedentedly needs to adjust to survive to this unprecedented occasion. So And the COVID-19 financial paradigm is similar to the effects that the COVID-19 has on higher demand and constraints for supply of healthcare services and equipment. With all companies discontinuing work roughly around the same time, we'll concurrently run out of money roughly at the same time. There's not going to be enough financial assistance to go around. So what tenants have in the bank today is all that they have, and they need to make the most of it. So the biggest factor in the COVID-19 financial paradigm formula is time. So the longer it takes us to fight the virus, the longer companies are paused, and the more runway they're going to need to reinitiate their businesses when we come back. So let's talk about the first time milestone, which was yesterday, which was April 1. So that was the first day that all of our rents were due. And I can't tell you who did and did not pay their bills on a macro level. There's no reporting mechanism to do that. Like, only time will tell. But I can also tell you that lower rent collection in the month of April will not break a landlord and send lenders to collect their keys. It's 1 month. So prior to April 1, we had half of March. But no rent in September, October, November, December, January, February. You get the point. If tenants collectively need the money, then we're not going to have enough to go around. So you have to budget for a COVID-19 financial marathon. And that's kind of what we're going to be talking about in terms of timing. Because when, and for normal tenants, and this isn't really, this isn't related to healthcare tenants for the most part, but when regular tenants are going to be down for 3 months, they're going to need another 3 months to get back. So they need assistance for a 6-month period. And what differentiates the typical healthcare practice, and again, I know that this is a generality and there's different ways of looking at it from each revenue model for each different practice. But in general, the day you open, you will have patients at your door. You're not going to have a downtime to get your business back again and find patients. They're going to be waiting in a lineup to come and see you. And landlords really do know that. And that's part of what's going to be the benefit of asking for deferrals, and also the landlord's comments back on that. And we'll get into that as we get into it. So let's talk about deferrals. So again, like all things COVID-19, there's not going to be enough resources. And when we all go for help, we ask for financial help. So in the olden days, which was 2 weeks ago, all the landlords would have said, come to me when you run out of money, then we'll talk. 1 week later, the message is, I know you have the money to pay April mortgage, May mortgage, and rent, but let's defer your payments by 6 months. So all the stakeholders in this commercial real estate ecosystem are aligned. Everybody, the consumer wants to make sure the services are there when they come back out of their homes. And the tenants want to be able to pay the rent, and the landlords want to pay their mortgages. So everybody wants to be in the same position. But so what we're talking about is taking a financial break today from your lender or landlord and use that money to stretch your business needs so you can survive. And from a landlord's perspective, they're going to collect their money. They're going to get it back. Whatever, it's not an abatement. It's not like, hey, you have 2 months of free rent. You've got to pay back that rent over the following 12-month period, and over your lease, or at the end of the lease. At some point in time, you're paying that break back, and you're probably going to pay it back with interest. So the landlords are motivated. Many landlords, not all, but many landlords are motivated because they don't want to end up with empty space, and the lenders don't want to take back the keys to the building. And like I said, we're not advocating for rent abatement. Like, this is not a free holiday. This is just putting off costs now while nobody's making the money, so that when we do make the money, we can pay our bills. And there's also a level of sophisticated communication that's important between the tenant, the landlord, and the lender, and the government. So the lenders have to say, yeah, we're going to give the landlord that deferral on mortgage payment, so the landlord can transfer that down to the tenant, and the tenant can say to the landlord, look, I am a specific type of school, or I'm a specific type of user, and I can't pay rent now. And the landlord has to say to the landlord, say, I have a school that can't pay its rent. You need to give me a deferral. So there is a communication, that an open one, that goes back and forward, and not as much as a negotiation. It's like, look, this is what I can do. This is what I have. This is what I can pay. So, and we also want to avoid companies stocking up on deferrals, like buying toilet paper. So if they need it, they really can use it. So here it is, why landlords love you. So let's focus right now. We've talked about the tenants of the market and general commercial tenants. Unlike general commercial tenants, for the most part, you have an unlimited supply of customers. Those patients out there are out there, and everybody needs healthcare, and they're going to need it more and more and more over time. And right now, as people are avoiding hospitals, they are holding back on looking for healthcare, getting that advice at this time until they really need it. So we know that when you open your doors, there will be patients ready to receive you. We know, and for elective surgeries and for, whatever it is, it's going to be a pent-up demand that, when we're done with this ordeal, the healthcare service providers are going to keep going. And as much as everybody needs a break, I think you'll be refocused to what you were doing prior to COVID-19. So what you can do is, and I'm going to go to the next one here. So if you're worried about your income and the effects of it, one of the things that we're talking to landlords about is taking that deferral, but not taking it today. Because if you know that you have a 12-month income and you can pay your rent today, but you know that I'm going to be opening up my doors and my revenue is coming later, I'm looking at it on a 12-month period, I'll take that deferral in November, December, January, February, because right now, the landlords are putting out a lot of money. So that's one of the things we want to, that's one of the things that we want to say to the landlord, like, look, we need a deferral. We don't need it this second. We'll take it later on. Use that money to give other tenants deferrals, because you only have so much money to go around. So in 6 to 8 months from now, when you're getting your income back, you'll be able to give us that break in our rent. And we don't need 6 months of free rent. We need 3 months, because we don't need 3 months down in social distancing, and we need it in 3 months in 3 months of growing our business. Our business will be there in day one, so we could take less of a deferral. And you're going to get a pushback from landlords. The landlord pushback on doctors are, hey, you're a doctor, you're going to make money, you're not going to go out of business, you're going to be there. So there's another conversation that has to happen, and that will, sorry about that, I'm just moving this around. That will have to get pushed. And if you're in a long-term lease and your landlord says no to your deferral, and there's limited options to you that in order to leverage if you don't have a lease that's coming up in the near future. So how you communicate, how you approach your landlord is very important. And our economy in general, I think, will be coming out of this versus the US. Everyone, anecdotally, it sounds like we will beat the US out of it. And that will have also an increase in, it'll have an effect on our economy as well. So from my perspective, the healthcare professional has a lease advantage. You can use that to leverage your income and to lessen the impact of less patients being seen in this period of time. And before I pass this on to Brendan Madden, we are here. It's free. If you have any questions, if you need us to draft letters for you to your landlords, if you need us to engage we really understand what you're going through, and this service is available for all healthcare professionals. We want you to know that we appreciate everything you're doing, and that's going to be our position at Titan York always. So I'm going to bring Brendan Madden in, and he's going to talk about healthcare leasing. So let me stop sharing here. Brendan, you want to come on board?
Of course. Thank you so much, Aaron.
There you go.
Let me just pull this presentation up here. So again, Aaron, thank you so much for the wonderful State of the Union on sort of how things are going and what to expect moving forward. I know you and the majority of the team at Titan York has been on the phone, most days over the past couple of weeks, speaking with clients and tenants, commercial tenants, with regard to rent deferrals, what they're experiencing right now and really what the best route forward might be. So I'm hoping that everybody in attendance has found that State of the Union and sort of the best route forward with regard to the current state of the economy beneficial. For those of you who I haven't had a chance to introduce myself to or a chance to meet in the past who are joining us today, my name is Brendan Madden. I'm a commercial lease analyst with Titan York Commercial Realty, but I work primarily with healthcare professionals, mostly healthcare professionals who are looking to start a practice, negotiate a lease agreement, whether it's coming up for renewal, they're looking to take more space or relocate their practice. And very importantly, those doctors looking to transition out of healthcare, maybe sell the practice or move on, and ensure that the lease agreement for their space is properly structured to support that endeavor. Now, I've had the opportunity over the course of my career to lecture to different groups of doctors and provide continuing education courses across the country. And the first question I typically like to ask when I start these seminars, typically in person, is what is a lease agreement? And I'll usually go around the room and ask every doctor in the room, the first word that comes to mind when you think about a lease. What is a lease agreement? And intuitively, we all have a pretty good understanding and idea as to what a lease agreement is, right? I'll get the answers. It's a contract. It's an agreement between the landlord and the tenant. In some cases, I'll get it's a marriage certificate, right? But I always get the answer along the lines of it's expensive, it's a cost, it's a liability for the practice. And I'm always wondering, why is that one of the first things that comes to our mind as healthcare professionals when we think about a lease agreement? And it makes sense, right? For the majority of you on here today, the lease agreement and the occupancy expenses for your practice are one of the highest expenses on that income statement, right? Typically line 3, apart from staff salaries and sundries or supplies, we see that occupancy expense. So it makes sense that, we think about the lease agreement as an expense that we need to keep down or try and keep as low as possible. But for all of you in attendance today, I would argue that the lease agreement is actually a check. And I would argue that the lease agreement is probably one of the most, if not the most expensive checks that you will ever sign in your entire lives, both personally and professionally. Right, on average in the Greater Toronto region and really across Ontario, we're seeing all-in rental rates at approximately $40 per square foot. Right, that's all in. That's the net rent plus the additional rented, those taxes, maintenance, and insurance obligations that you pay on top of the base rent in a triple net lease agreement. Right, so on average, $40 per square foot, and let's agree that on average, healthcare professionals will lease approximately 2,000 square feet of space. On an annual basis, that $40 per square foot becomes an $80,000 expense over the course of a year, right? And most doctors, which we'll get into, should be signing an initial lease term of 10 years and ideally 2 5-year options following the initial 10-year term. Right after 10 years, that $80,000 becomes $800,000. And if we can agree that the average doctor will spend approximately 30 years in private practice, that $800,000 expense becomes a $2.4 million expense. And I hope that if someone would have put the lease agreement in this perspective, in this light for you prior to signing off on it, or before you sign the next renewal or the next lease agreement for your practice, you would take a little bit more time to think about the 40, 50, 60, 100 pages that follow the first 2 pages on that lease that discuss the rent and the term that you're owing to the landlord. They've got significant impacts. So it's my goal today to convince every one of you that it's not all about the base rental rate when we're negotiating a lease agreement and when we think about a lease agreement from our practice perspective. The legal terms and provisions following those first 2 pages that discuss the rent and the term are critical to get right for a healthcare practice and will ensure, if properly structured, that we have a solid lease agreement in place for the majority, if not the entirety, of our careers. So why is the lease agreement so important then? Well, first and foremost, for most of you, the lease agreement or the office location is the foundation of your practice, right? Without a location to practice, we can't see patients. If we can't see patients, we cannot produce healthcare services. And if we can't produce healthcare services, we can't earn a living, right? We have no production. Without a solid and properly structured healthcare specific lease agreement in place, the security you have in your space is not guaranteed, period. Secondly, the lease agreement is so important because the business of healthcare is one of the most expensive businesses, if not the most expensive business to enter into in the country. Right? We make a significant investment into most of our spaces. A dentist, for example, on average, will spend approximately $200 per square foot just to build out the space, just to construct the space, right? That doesn't include equipment. I've seen dentists spend over $500 per square foot just to build out their space. So in a 2,000 square foot space, a $200 per square foot build out cost would be approximately $400,000, right? We add on top of that equipment and other business startup costs, and we're looking at approximately $800,000 to over $1 million just to get into that space and get it built out so that we can see patients. So for that reason alone, you as healthcare professionals should have a more solid lease agreement to protect you than the majority of your neighbors or other tenants in your building. Along the same lines, it's very costly and time consuming to relocate, right? The majority of you did not buy or start your practice with the intention of relocating it in 3, 4, or 5 years, apart from potentially a tuck-in acquisition. So in order to ensure that we have security in our space and we're not forced to relocate earlier, sooner than we ever expected, it's critical that we get that lease agreement properly structured and unique to our practice and specific to healthcare. And finally, the lease agreement can make or break a practice sale. The 3 components of a practice when we look to sell it are the equipment, our goodwill, the goodwill that we've accumulated over the course of our career, and what holds those 2 together is the lease agreement, having a lease agreement that we can transfer to the incoming buyer of our practice. So it's critical that lease is properly structured and will cause no issues at the 11th hour of a practice sale so that we can smoothly transfer that lease and move on into whatever our next endeavor might be. So then what is it that the lease agreement should do for you? Well, it absolutely should provide for fair and affordable financial terms. But again, that's not only the base rental rate, right? Especially when we're starting a practice from scratch, there are a number of different things that go into the financial terms that we need to ensure are properly structured. The tenant improvement allowance, which is money that the landlord may contribute toward the build out of our practice and our space, right? Free rent periods, fixturing periods. Are we looking through the additional rent section in the lease agreement to ensure that we're comfortable with it and it's well structured? There's a number of different items that go into an additional rent article, and we should ensure that we have recourse in the event the landlord is passing through items that we're unsure of or that we don't believe we should be paying for. The lease agreement should also provide us with long-term stability and security in our space. With rare exceptions, most of you joining us today should be signing long-term leases, which is a 10-year term with 2 or 3 5-year options to renew, right? We should be looking to get as much runway as possible, thereby obtaining long-term stability and security in our space and ensuring that we're not forced to relocate, or we're not forced out of the building by the landlord prematurely. The lease should provide us with flexibility as well, right? The majority of you got into private practice for a reason, right? And it's because you see your ability to run that business effective, right? So we should have the flexibility built into the lease to give us that chance to run the business as we see fit, right? For example, the majority of doctors I speak with don't realize that in their lease agreements, there's an article typically that discusses the business hours for the practice and when you must be open, and in some cases when you cannot be open. Now, what happens if we take an extended break from the practice and we look to either go on vacation or what have you for 2 weeks, 3 weeks, a month's time? Does that cause you to default under the lease agreement? Well, in a lot of leases, it would. Do we have death and disability provisions built into the lease agreement that would state, God forbid, something were to happen to us and we could no longer continue to practice, would allow us to terminate that lease agreement upon a certain number of months' notice, right? We need to be thinking about these clauses that provide us with flexibility in the lease. An ROFR, as you see in front of you, is a right of first refusal. Typically would state, if we needed more space in the building, if we needed to expand and an adjacent space became available, we'd be able to knock down the wall and have first access to that adjacent space rather than having to think about a relocation of the practice, worry about attrition, things of that nature. The lease agreement should also limit our personal exposure, any personal exposure that we have, right? I'm shocked consistently by the number of doctors I see who have signed unconditional, irrevocable, absolute, and personal continuing personal guarantees under the lease agreement, right? This basically states that in the event there's a dispute between landlord and tenant, your practice, the landlord could come after you personally for the fulfillment of the lease obligations, right? When a doctor first starts a practice, I'm not so concerned about providing some form of a personal guarantee because typically at that point we have significant debt and we do not have a significant net worth. But as we move forward throughout the lease term, those personal guarantees should fall off. They should be limited personal guarantees. And certainly a doctor looking to transition and sell their practice should not have any personal liability under that lease agreement. At that point in your career, you've shown your ability to pay rent, to run a business effectively, and we should be removing any personal exposure. If we're able to do all of this to the lease agreement and more, it will act as an asset for us as opposed to a liability when we look to sell the practice, right? When we look to transition out of healthcare. All other things being equal, if you could buy one practice with the same revenue as another practice, but one had the landlord's standard form of lease, which has not been negotiated and made healthcare specific, and the other was a healthcare specific lease agreement that guaranteed us term for 20 or 30 years, which practice would you pay a premium for? So I want to jump into some key lease terms, and I'm going to go through these fairly quickly for time's sake, and certainly we're happy to address any questions in the Q&A following this presentation. And as Aaron mentioned earlier, we're also more than happy to take any questions with regard to your specific situation. But there are a couple of articles that I'll go through in your lease agreement that should be made healthcare specific. And these are a couple important ones that you should be aware of. So first and foremost is the option to renew article. The option to renew article, for those who are not aware, is basically a right that you obtain in the lease agreement that would allow you to renew the lease for another 5 years of term, for example, following the initial lease term, right? And as long as we exercise that option to renew, the landlord cannot terminate the lease agreement. As long as we're not in default and we fulfilled the lease obligations. These options for healthcare professionals in particular cannot be personal. They need to be transferable to an incoming buyer of the practice or someone who takes over the practice and the lease agreement for you. In a lot of lease agreements, it will state, provided the tenant has given notice to the landlord, then they have the option to renew the lease agreement. That word tenant will have a capital T, and any capitalized term in a lease agreement means that it's defined in the lease. And capital T tenant is defined typically as your professional corporation or you personally. We need to add language to that option to renew that will ensure anyone who buys the practice can also exercise that option. Most banks, for example, will not finance the acquisition of a practice with less than 5 years, and in some cases 10 years of term remaining on the lease agreement, right? They don't feel comfortable if we only have 2 years remaining on the lease. Landlord could terminate the lease following those 2 years. Most banks will not finance that acquisition. If we had transferable options on the back end and the buyer of our practice could exercise those options, we can ensure that they'll get financing for that acquisition and things will go through smoothly, right? So they need to be transferable. They cannot become null and void in the event that you default on the lease agreement throughout the term. As long as you cure that default, they should be exercisable. They can't be on the landlord's then current standard form of lease, right? Let's say we make a bunch of changes to the lease before we ever sign it. We come to renew the lease agreement in 10 years, and the landlord has the ability to place in front of us their then standard form of lease. It could basically negate any negotiations we had done initially to make the lease healthcare specific and protect us as a tenant. Rent determination should go to arbitration. So we need to ensure there's language in the option to renew article that states if the landlord and the tenant cannot come to agreement on a fair market rent for the renewal term, it will go to arbitration. It doesn't become null and void. And ideally, we should remove language in the option to renew article that states the rent can never decrease. This is often challenging in a negotiation, but certainly something worth taking a run at, right? If the market collapses and when we come up to renew, rental rates have not yet returned to the levels they were at throughout the term or before we had signed the lease agreement, when we come to renew, the market may be below what we're paying right now. But if there's language in the option to renew article that states our rent cannot decrease, it will either stay the same or there will be an increase in our rent rather than coming down to those new market levels. The next article that I'll go through with you is the assignment article, which is a critical article for the majority of healthcare tenants. This is the article in your lease agreement that deals with your ability to transfer the lease and assign it to any purchaser of your practice, right? Once we reach the end of our careers, in a lot of cases, we will transfer and assign the lease to the purchaser. It's critical that this entire article is well structured. I've seen nightmare scenarios if it is not, and can cause, a deal not to come to fruition at the 11th hour if it's not properly structured. So when we look to assign or transfer a lease, we usually need the landlord's permission to do so. It should say in the assignment article that that permission will not be unreasonably withheld, conditioned, or delayed. Anything else is, from my perspective, not doing you justice, right? It should state it shall not be unreasonably withheld, conditioned, or delayed. Often there's language in a lease agreement in the assignment article that states the landlord, upon request to transfer or assign a lease, can terminate that lease, or they can recapture the space. Now you can imagine for the doctor at the end of their career looking to transfer that lease agreement and transition from healthcare, in the event the landlord just takes that space back or terminates the lease agreement, they're in a very bad position. So this language in the lease agreement needs to be properly structured. There should not be any language in the assignment article in a healthcare specific lease agreement that states the landlord can increase the rent for the buyer of the practice, can request consideration in connection with the assignment of the lease agreement. These can all end up being deal breakers at the 11th hour of a practice sale. So let's ensure proactively we're making changes to this article to support our goals through a transition in the long term. There are a lot of doctors that I've worked with who were unaware that they had continuing liability on their lease agreement, right? Most assignment articles will state that in the event the purchaser of the practice or the person that you assigned the lease to, if they default on the rent or default on any of their rent or lease obligations, the landlord can come after the doctor who assigned the lease initially, the seller or the vendor of that practice, right? So I've seen some situations where that vendor, now enjoying retirement, receives a phone call stating that the young associate who bought their practice and has never run a business before has defaulted on the rent obligations, and that more established doctor at the end of their career has had to come back to that landlord in order to provide those lease obligations. So let's avoid that. Let's make sure this type of language is removed from the assignment article. And finally, let's remove any reputation or language in the assignment article that discusses the reputation of the incoming buyer of our practice and their business experience. In a lot of cases, when we're selling a healthcare practice, we're selling to a younger associate who has not run a business in the past and has just come out of school, typically with some debt, right? So if there's any language that says the person that we're assigning the lease to needs to have the same net worth as us or a higher net worth than us, or need to have the same level of business experience or reputation in the business community, these are not going to work in a healthcare transaction, right? We need to make sure this type of language is removed so that we can sell to that person or that associate that we choose to sell to. There are a number of other clauses, and for time's sake, unfortunately, I'm not going to be able to go through all of them with you, but the clauses that you see in front of you are all critical for a healthcare specific lease agreement, and all of them should be negotiated specifically for your practice, for your situation, and for your goals over the short and the long term and through a transition. If there's anyone who does have questions about specific articles, we're more than happy to discuss that with you. relative to your specific situation and provide guidance on the best negotiation option, or what language should be inserted into these articles. But keep these clauses in mind, and I would encourage all of you, when you have a chance, go through your lease agreement, take a look at some of these articles, and if you don't feel comfortable or you're not certain that they're structured in your favor or will support you throughout your career, let's have that conversation and proactively ensure that moving forward, we get them addressed. So some key takeaways, as I mentioned in the beginning, it's not all about the base rental rates in a negotiation. I've seen far too many doctors give up all of their leverage in a negotiation to get $1 per square foot in a rental rate reduction, right? And while that might seem like a victory in the negotiation, in a 2,000 square foot practice, that's going to save us $2,000 on an annual basis, that dollar per square foot rental rate reduction. And the majority of you joining us here today will bill that in 4, 5, 6 hours, right? So let's not give up all of our leverage negotiating the base rent. Let's ensure that the legal terms and provisions in the lease are also properly structured, because they can cost a practice hundreds of thousands, if not the entire practice. And finally, in a typical environment, we recommend all of our clients begin the renewal or the negotiation process about 2 years, 24 months prior to a lease expiration or option to renew deadline. In the event we commence discussions with the landlord this far out, we have time on our side, we have leverage. The landlord knows that if we needed to relocate, we would be able to within that time period. If we wait too long and commence the negotiation 6 months prior to an option to renew deadline or a lease expiration, the landlord knows we can't pick up and move a practice that quickly, or we'll see significant downtime and likely significant attrition. So let's start the process proactively, start the process early. So at this point, I'd like to again thank all of you very much for taking the time to be here. I hope that you did find it beneficial. I hope that we were able to provide some insight in these challenging times. We will move on to a Q&A, and both Aaron and I will stick around for some time to address any questions that you might have. This webinar will be available as a recording. So I know we went through a couple of items fairly quickly. You will have a chance to review it. And again, we are offering to healthcare professionals complimentary lease review consultations at this point. So if there's something throughout the discussion today that you weren't certain on, or you would like some further guidance on, we're more than happy to go through that article or that lease agreement with you and walk you through from our perspective what the best route forward would be. So Aaron, I will let you jump back in, and we can
thank you.
go to the Q&A, I believe.
So the first one was, my landlord won't defer my rent and I personally indemnified my lease. What is going to happen? So the first one is, the first thing is that you have to start a dialogue. I mean, that's the very first answer to that question, is you got to go to the landlord and say, look, I can only do what I can do, and this is what I can do. These are unforeseen times, and we are required that we cannot be open by the government. And if you can't provide that, then you're going to have to make a business decision that will either, you're going to have to make a business decision, and it's going to go from depending on how long you're down for. And right now it's very new. The landlords and the tenants are just getting used to a new normal. And it's only been almost 3 weeks. So, and each week brings a new, more information, more guidelines, more challenges. So when we first started, here's, and I'll talk about where I think people's brains are going and decision-making processes are done on what you think the timeline is at that time. We thought that we've been in social distancing from the 16th of March, and the COVID-19, everyone said, well, it's got a 14-day incubation period. The mean is 6 days. And we should see a rise on Saturday, Sunday last week, we should have seen a massive rise. The testing is really 5 days in advance. And as we got to Wednesday, Thursday this week, we should be seeing a drop. Well, I think it's still going up. But is it skyrocketing? So then everyone says, well, okay, we're now in until July. So before we were into the end of mid-April, now we could be here, the next conversation was July. Well, what does that mean for our rents? So I think the conversation each time you go back to the landlord depends on what the news was that day. And yeah, you can go back and say, look, I need to renegotiate. And if you can't pay your rent and you're out of money, there's no conversation. You can't pay your rent. And again, it's not necessarily about paying your rent today. It's about being able to also pay it in 4 or 5 months from now. So it's a fluid situation. Keep the communication dialogue going with the landlord. Write down everything. Make sure it's all in writing so that it's not he said, she said, and that will also help benefit you. There's another question here. What's the best way to contact me to get a complimentary lease review? My email is I'm going to answer live. How's that? So I'm going to put it up here, and I think it's going to be in the presentation as well. Nope, it's not letting me do it. we're a bit new to it.
Try type answer.
Can you do it?
I think so.
All right, Brendan's going to try. I can tell you that my email is AGRA, B as in Bobby, E as in elephant, N as in Norman, at Titan York, TITANYORK.com. There we go. Anthony just put it up there in the chat. Thank you, Anthony. Do you expect the same kind of rent vacancy rates in the medical market as in traditional office? If so, what options do I have? We don't. We expect that the vacancy rates in the medical profession office will be low. That at the end of the day, if you're in a medical building providing medical services, that there are a specific supply of doctors in the market providing a type of service that is so in a certain, providing their services in a certain way. You can only do so much with the human over teleconferencing. You have to see people and see what's wrong with them. So that inherent requirement in delivery of medical services, and again, I'm generalizing, will require space for doctors, and doctors will continue to need space. And that is one of the things that will go on. I don't think that there'll be a lot of vacancy at the end of the day. But again, there is doctors that can move. So if you are entering in with your landlord, there's a conversation to be had. I think I answered, what if I've signed a lease with some of these issues you mentioned, can I change it now? When you go back into, that's tough to change a lease in the middle, in the course.
Yeah, Aaron, it depends on where they're at in the term of the lease agreement. If they did just sign it, unfortunately, in a lot of cases, it is very difficult, if not not doable, to make changes to that lease agreement in, the first year of the term, the second year of the term, something along those lines. As mentioned, we look to start the process and conversations with the landlord, ideally about 24 months before a lease renewal deadline or a lease expiration date. So I would say the earliest that, in our experience, we have started conversations with the landlord would be about 36 months. prior to a lease expiration date, right? So, if you're in the first half of that lease agreement, then it may be difficult, and it does depend on whether it's a 5-year or a 10-year term. But typically about 36 months before an expiration date, we can begin that process proactively. So I think that would be the best route to take at this point. If you're in the very initial stages of that lease, then unfortunately there's not much that can be done.
And I want to preface it also. So if you're at the beginning of a lease and the landlord is putting money into a lease for leasehold improvements, then there's when you're at that stage, then the landlord's not going to just have a shell company or a numbered company on the lease. If they're putting money out, they want to make sure that many times that it is personally guaranteed, and that and you can't get away from that. And in also as a respect to when you're negotiating a lease, let's say you have 5 years. Many doctors are now going to be in this great position where, let's say they have 2 or 3 years left on the lease term and they're not in a medical building. So they're in a standard office building, and that office building will have a ton of vacancy coming out of the marketplace, out of this process. So when COVID-19 is over, in 6, 7, 8, 9 months from now, we're really going to see what it does to vacancy rates. If vacancy rates skyrocket, like where there's just a lot more space in the market and prices are dropping, and the tenant who's a doctor is in this office building and they've got 3 years left of the lease term and their rental rates are higher than where the market is, we often go back to the landlords now and at that time and negotiate and extend and blend. So basically we extend our lease term out now early. We take the higher rents down, the lower rents later, and we blend them together so that we automatically get a drop in the rental rate process at that time. Let's see if we have any more questions here. I can push the button. Oh, here it is. My landlord and I have a great relationship. Why should I engage you for renewal? I don't want to rock the boat with him. So I get that a lot. Firstly, my response to that is, I'm not here to start a war with your landlord. That's not it. Your landlord is an expert in what he does, and you are an expert in what you do, but you are not an expert in leasing. So this is your second largest expense next to employees. And if you're just going to be like, hey, buddy, no problem. Like, I get it. Sometimes it really isn't a brain. I use the term loosely, but it's not brain surgery. Here it is. You're going to keep the same rate, just extend the term. Away we go. I get it. But you'll see that some landlords will come in a lot higher. And it isn't just about the rate. As Brendan said, there's a lot of things in your lease that need to be evaluated and fixed. And that's part of the service that we're providing. And landlords are used to us. They know who we are. They know that we're calling. We're calling on your behalf. So I get that question quite often. I get that question. Having a close relationship with your tenant is a very good landlord. That's what you should be doing. At the same time, this is your lease. It goes on for a long time. It's not just about the money. If you're ever thinking of selling the business, you want to make sure it's well looked after, and that's part of the value. If it's just about price, that's not what we're just about. We're about making sure the whole thing works all together. And it depends on what building you're in, how we can affect it. Where in the city you are. There's all kinds of ways that that change the factors, but having a conversation with us will be very, very fruitful. Let's see if there's something else here. Oh, why wouldn't I just hire a lawyer to negotiate my lease then? Because lawyers also don't know what's going on in the marketplace. So lawyers are very good at telling you what you can't do. We're good at also telling you what you can do. So you can't negotiate in isolation. And what that means is that you need to understand what the market is doing in its totality, and a lawyer can't give that to you. So, and a lawyer doesn't know your landlord. The comment is, why would I use you? Well, we know your landlord. They know us. And we know the other landlord around the corner. And we know the other landlord on the other side of the city. So using us to negotiate means that you are at least benchmarking the deal that's in front of you.
In my experience, just to add on that as well, Aaron, most clients that we've worked with, their attorney was more of a general attorney or a general lawyer, right? A generalist, and they weren't specific to healthcare or specific to that client's industry, right? And say they may overlook certain items that we have experienced in negotiations with landlords for healthcare professionals. So it's that specificity as well that makes a big difference.
I've got a question here. What if my lease was expiring in the next 2 months and I had no intention of renewing? How do I go about with rent deferral, or is termination an option since my clinic will potentially be closed for the next 2 months? I can't advise you to default on your lease. That's the question. You have to make a business decision. I can tell you that I pay my bills and I hold up to my obligations. And if I have to have a change in my obligations, I do so through a conversation, and that's part of what I do. And if it means that I have to have a greater conversation about it, I will have a more in-depth conversation about it. If it means I'm going to yell, I'm going to yell. But the answer is that that's a tough one. If you're really going to be out of there in 2 months and you're closing it up, you got to make that decision for yourself. I don't advocate for abatement. I advocate for deferral. So, if it's like, hey, look, I'll pay you, give me 2 months now and I'll extend my lease by 2 months and I'll pay you in those 2 months. That's probably the better way to go. You can see that this is an ecosystem. At this point in time, we're not out to screw anyone. It's not about taking advantage of the landlord. You're paying back that deferral. We're not here to put any landlord in a position where they're going to be, out the money, that it's a loan over a period of time. So one way or another, there's creativity to figure that out. I think that brings us to the end of our questions. Brendan, thank you so much.
Thank you so much, Aaron.
That was amazing. That was a great job. That was so informative, and I totally appreciate, how succinct you were about it, and I really appreciate you sharing with us. Thank you. If you can, we look forward to talking to you all. The offer is out to you. Please don't hesitate to reach out. In this industry, we know that things are all over the place, and I would love to talk to all and every one of you. So Brendan and I are here for you, and thank you very much. Have a great day. Be safe. Stay home, and and if you're not, then thank you again for all that you're doing for all of us out there. It is not without its appreciation. I hope you've heard it here and you've heard it everywhere. Have a great day. Thank you.
Thanks, everyone.
Bye-bye.